Happy Thursday. Almost holiday weekend. It's so great to have you joining us today. Greetings to you. My name is Bren Lovegood. My pronouns are they, them, and I am the Senior Manager of the Leadership Excellence Networks, which is known here as LENS. Welcome to NCHL's May Coffee Chat, which will focus on, we'll focus on the time is now addressing the nursing shortage with transformational organizational change. And before we get started, I have a few housekeeping items to note. First, if you have a question or comment for the panelists, please submit directly into the Q&A section of the webinar. While we are going to try to hold time for questions at the end, 30 minutes goes by really quickly, and we often have a lot of information to cover in a short period of time. So if we don't get to your questions, we will note them and we will follow up after the completion of our event. We are recording this session. It will be available on our YouTube channel within 3 business days. And additionally, a link of the recording will be sent out to all registered attendees. To increase event accessibility, we're utilizing Zoom and have enabled closed captioning. So should you choose to enable your own closed captioning during the event, please click on the closed captioning button on the bottom of your Zoom window. NCHL values promoting diversity and inclusion through equitable access of our events, and we really welcome any feedback regarding ways we can improve accessibility for those who are participating. So please do reach out to us at info@nchl.org should you have any comments, suggestions, or ways in which we can improve. We also will be sending out a survey for your input after today's coffee chat has ended. And so without further ado, to get started on our event, I'm happy to welcome our panelists joining us today. Our Jarvis Racine, who is Vice President of Strategic Partnerships, Workforce Development, and Government Affairs at Herzing University, and Cheryl Paxton Hughes, Principal Consultant, Thought Leadership, and Advisory Services at Cornerstone On Demand. Both Jarvis and Cheryl have partnered with NCHL and are committed to improving the experience of our healthcare workers and how our organizations operate to the best of their capacity. They really are thought leaders and innovators in this space, and I'm really excited for our conversation today. So welcome to you both.
Thank you, Ren, appreciate it.
So first question I want to bring up, this has been something that has been debated a bit in the public sphere, and that I think is essential to the conversation we're having today. Is there a nursing shortage? What do we know about the need to increase the number of registered nursing professionals, and what data helps us to support the statement that we are facing a nursing shortage?
Yeah, great question to start. Cheryl, you want to go first, and then I can jump in?
Sure. So I think to answer this question, there is absolutely a nursing shortage. We have lots of data from the U.S. Bureau of Labor Statistics being a key source to many other data points, and we can provide those with you. And Jarvis, I know from your end on the university side, we know that we have over 100,000 people every year that apply for nursing school, and we don't have enough nurse educators, right? So we're not even capturing what we could be capturing in terms of nurses. So just to dispel that myth, there is plenty of data and research, and so we know there's a nursing shortage. Now, whether or not healthcare systems and hospitals are investing in the appropriate staffing models, patient to nurse ratios is a different topic, but we know that we need nurses, and I'd love to hear your thoughts on that more, Jarvis.
Yeah, absolutely, Cheryl. Thanks. I mean, if you just look at the stats, and ASIN just released some more information about this. National League for Nursing did as well. The stats are pretty substantial out there today. The need for nurses continues to grow and expected to grow by over 12% each year from 2023 to 2029. And based on that, they're predicting by 2025 a shortage of nearly 200,000 nurses across the country. So that's just and we'll drop these links in the chat, by the way, so you can fact check it if you'd like, based on on the links that we have today. The other part is you start to think about this is two things. One is that our population continues to age, and by 2060, like over the population of people over 65 will double, and the population of those over 80 significantly increases. And as we know, getting older, as we all are continuously, that has a real negative drain on the healthcare system overall. And then just finally, one other thing too, over 50% of nurses are over 50. And so we know that a substantial portion of those nurses are going to retire over the next 10 years, right? So you've got this confluence of all of these things happening at the same time. And what you just mentioned, Cheryl, at the end of this was that enrollment numbers and applications are declining in nursing schools. So, and you've got high nurse turnover as well, first-year nurse turnover. So all of those things coming together are just going to impact and really create a crisis in healthcare delivery.
Yeah, and I would say the crisis is happening now, right? We're in the middle of it. Absolutely.
Yeah, it is just unbelievable. Just really one of a couple real quick statistics here. Nursing school enrollment applications. So applications just in general to nursing schools was down 50,000 applicants this past year. And then actual enrollment in 2022 was down 1.4% across the board. And then when you break that down by type, RN to BSN enrollment down 16%, MSN enrollment down 9.5%, PhD enrollment down 4%, all of those things. And then you couple that with a faculty, vacancy rates of almost 10%, you've just got this massive issue coming together.
Yeah, and as I talk to my former colleagues who are in the healthcare space, and even friends and family that are nurses, to your point about declining enrollment, even in the master's and PhD programs, number one, we need more nurse educators, right? So we can enroll more people, and then secondly, we're not seeing a lot of individual contributor staff nurses that are wanting to take on leadership positions. That's another major challenge that's occurring. So again, just we're in the middle of this crisis right now.
Yeah, for sure. I mean, I think you start to raise a whole bunch of great conversations that we can dive into some more, Ren, as we kind of free flow all this conversation a little bit. I think it's a great point around shortages. And then when you talk about nurse burnout, how do you actually handle nursing burnout? How do you're just coupling this issue continuously with all the statistics I just talked about before, but we've got to really kind of come at this a little differently from the gap perspective and first year nursing experience and clinical preceptor roles. And there's all sorts of action that's being taken on the government side in states to make things more attractive. And we can dive into some of that as well, Ren, when you want to.
Yeah, so Jarvis, I know Herzing University is committed to educating the next generation of nursing professionals, and you partner with healthcare organizations to ensure that students transitioning into the workforce are prepared to be successful in their role. But what are some of the barriers that you're seeing? Because you shared a statistic with me around how many new nurses leave the profession, I want to say within the first year. So yeah. Maybe we could talk a little bit more about kind of the operational challenges to, I think, even getting trained nurses in and their retention.
Yeah, for sure. I mean, if you think about first year nurse turnover, and I'll drop the link here again in the chat. 17 to 30% of first year nurses leave within the first year, and then another 50% of those nurses will leave in that second year. So we are really not figuring out how to create a great onboarding experience and then provide the right support networks for new nursing students. And this is, this number continues to climb. And as many of you on this call know, the reality around the cost of nurse turnover, I mean, it's at least $50,000, and you could argue with benefits $100,000, right? I mean, the numbers are high, Cheryl, and I'll let you jump in on that one. But just regular average nurse turnover is 27% a year. And I saw a statistic this morning that in 5 years, 100% turnover in nursing at hospital systems. So when you calculate that out over a 5-year period of time, you're literally turning over your nursing ranks every 5 years. which is just not a great statistic, right? So, we're really committed to trying to find ways to work with healthcare systems to help that onboarding experience, create more and more shadowing experiences, increase capacity for clinical and preceptor opportunities, which is absolutely critical as we move forward. Increase simulation work as well, because that's really critical in nurses' ability to feel like they understand how to react to scenarios as well. And then working with organizations to try to find pathways to help those nurses who are burning out move into more precepted roles, creating dedicated educational units on floors, et cetera. So I know, you've got a lot of information around, cost of nursing turnover. Want to hop on that one for a minute?
Yeah. And I'm sure a lot of our listeners have seen this report, but it was just released, I think about a month ago or so. And that's the 2023 NSI National Healthcare Retention and RN Staffing Report. And there's some pretty staggering numbers in that report. And to your point, the average cost of a bedside nurse, and again, right, you should do this for your own organization, but was around $52,000 a year. And what's even more staggering is the amount of travel nurses, right, that we're seeing deployed, which is literally when I talk to our healthcare customers, it's not sustainable, right? There's no way they'll go bankrupt, right? They can't continue to pay those wages, and they're losing nurses to travel nurses because of the flexibility, because of the better pay. And if a hospital system or a hospital can replace just 20 travel nurses with an in-house nurse a year, that's basically $3.14 million savings annually. And I didn't say it, the NSI National Healthcare Retention Report said it, right? So I think when we're talking to our customers, this is something that everyone's trying to solve for. All of our HR leaders have been charged with figure out retention, but the problem is it's not an HR problem. This is a systematic, and I know we're going to get into this discussion, but we can't keep using the same set of tools we've always used. I think the definition of insanity is I keep doing the same thing, but I expect a different result, right? And so this is hard work. But if we really want to tackle this problem, there has to be fundamental shifts in how we design, staffing models, how we design rewards, and not just pay. I think most of us on this call understand that pay is a hygiene factor. And once you're, comfortable and your needs are met, the second most important thing has to be with your manager. People do not leave organizations, they leave leaders. And so there just has to be this fundamental shift in how we have always done things if we really want to address retention. And it's not HR's problem to address.
Yeah, no, it's great. I mean, I think when we start to really dive into why the turnover exists, workload, lack of support, work-life balance, working conditions, benefits shows up on that list, but it's not necessarily the first piece on that list. Recognition and then pathways forward, right? I mean, those are all major issues in terms of employee retention that come into play, and they're not really, quite frankly, that different from what everybody else says about why they leave an organization, right? So I think the universe is trying to figure out how do we retain employees long term and keep them happy and keep them growing with us, right? I think, and we're seeing more and more use of education to support that. We're seeing organizations really start to invest significantly more dollars in educational pathways for their employees so that they can build that commitment with that employee longer term, right? So we're seeing, the use of more and more stackable credentials in that space, right? So, it's interesting to see that the RN to BSN enrollment was down 16% in 2022. Because that's, it's sort of like, that's one of the levers that organizations pull now to help, defray the cost and help retain employees over time is, you complete that 2-year degree, will help pay for that 4-year program and move that forward. And we're seeing a lot more of that kind of work day in and day out.
Yeah. And I think what we're seeing on our end, from the more like kind of from a corporate, learning and development space, if you will, is we are seeing a lot of our healthcare customers really starting to take leadership development, right, and in a different lens, and really thinking about it from not the director or the manager level, but all the way down to the charge nurse, because that's where the impact is. And what we're hearing from nurses is, I want to feel like I'm that you're supporting me, that you're on the floor with me, that you're not just sitting in your office and giving me a new patient admission, admit, and then you're kind of like, you're nowhere to be found and you're not helping me. It's that active and visible leadership. Healthcare, look, is not unlike any other industry where we take a really great nurse and they become a nurse manager, and they don't know that they're going to have to deal with all these people issues now, right? I'm going to have to mediate conflict. I'm going to have to deal with people's emotions, on top of all the scheduling, right, and the documentation and all of those activities. So I think one of the things, if we really want to get serious about retention, and we know that people leave leaders, in addition to what you said about just that 1 to 2 year nurse turnover, we know that great onboarding processes, retain people longer, and absolutely essential for that 1 to 2 year. And by the way, if you think about the demographics that might be in that 1 to 2 year, that we're probably looking at Gen Z, I think, that's the new term, right? Yeah. And they're not like the prior generations, right? If they don't feel like they're being supported and they don't feel that connection, they're not just going to stick it out, right? They're going to go somewhere else. So yeah, I'd love more of your comments on that.
No, I think absolutely right. I mean, it's clearly leadership is culture, right? So I think, we talk a lot about culture, and I think especially for nurses who are working a 12, 13-hour shift, for them to take time out to sit with a manager to talk about their future, it's like, okay, come on, I have to save this patient over here. I've got so many patients, or you have me precepting a student right now, and I don't have time to sit there and talk about this, right? So you have to create culture around this opportunity to really sit back and have these conversations with people so they feel valued. I mean, that's such a significant part of this. And then to talk about what their pathway looks like, because everybody wants to have an understanding of where they're going to go in the future, right? And it could be that I just want to be more and more of an expert in my field and what I'm doing. And for others, it may be, hey, I'd love to be a nurse leader down the road. How do I get into a program that will help train me to be that charge nurse and then take that next step up, right? But culturally, organizations have to embrace this. And when you see, and you and I think going to multiple hospital systems across the country, we can quickly identify a culture that supports this and a culture that doesn't. It's clearly evident, right? And it's sometimes it's surprising when you walk into an academic university and you expect it to have this amazing culture around this, where it doesn't exist. And then on the flip side, you see a rural hospital that's just doing this like in an amazing way that's just, it's just so powerful for their employees. So it really is about driving that culture. So I absolutely agree that it starts with those opportunities.
Yeah. And I would say for those who are listening, it can be overwhelming to hear this information and think, well, that's great, but really, like, how do I apply this? Right. And I would say, that even if you don't have a culture, because it really does start from the top. And I think that's why you see where an academic medical center may not have it, but a rural hospital would, right? Because clearly there's a CEO at the top of the organization or somebody at the top that finds this to be important and is driving it and invest in it. But even if you're in a situation, I always tell people, start with a department, right? Or a unit, right? If you know that there is a leader in that area that does embrace it, like, just because the rest of the organization hasn't made that shift yet, go work, right? And spend time in that unit and try to get an initiative going in that unit. I know it's not going to be systemic wide, but you've got to start somewhere to start making those changes.
Yeah, absolutely. A couple of questions that popped up in the chat. One that I really like to kind of chat about for a quick second, because I just think there's some really great questions coming up here. The first one, really quickly, and I can answer this quickly, is that absolutely we are seeing a return to 2-year RN programs. There's no question that speed to nursing, and I mean that in terms of time to complete, LPN to ASN, bridge programs, LPN to BSN bridge programs. Those are military medic to LPN pathways into those higher degree levels are taking off across the country. So absolutely, I think that's a great insight into the culture that's happening right now. And again, driven by workforce. I don't know that that will last forever because obviously, magnet status for many of our hospitals is still important across the country. But the reality of how do I take care of the patient in front of me right now is superseding some of that conversation. So, absolutely agree with that. I think where I want to go for the next conversation, Cheryl, I'd love your thoughts on this one too, is this virtual nursing thing that's taking off. And I just read a couple of articles the past couple of weeks around, these sort of like nursing call centers now that are popping up where, you've got now in a patient room, you've got a camera that's there nonstop. You've got this ability for admissions and discharges now. And for like an on-call question, like I see technology in general helping to address some of these short staffing situations across the country. And it'll be interesting to see how this really plays itself out over time. Love your thoughts on that too.
Yeah, I mean, listen, I think to think that it's not gonna take off or it's not gonna happen, it's going to, right? We think about 5 years ago now, COVID helped speed up like a lot of what, remote work and that sort of thing. But I think not only we're gonna have to find some short-term fixes to some of these staffing problems that we need to fix now while we're deploying the longer term solutions like we've been talking about with culture and leadership. But I think that, the organization, I think there's going to be, like with any technology that's new, right? There's going to be early adopters and then there's going to be those that lag. I think healthcare systems would do really well to look at industries that are maybe not in healthcare that are using these, right? And
Right.
because, right, if we only look inside, right, we're not going to necessarily get anything that's innovative or creative. But, I guess the jury is out on how effective. Now, obviously, if we're measuring patient satisfaction, maybe that we could see a drop in that because the patients perceive it to not be right as hands-on as an in-person. But I think it's the reality of where we're at. And I do think as we, as our generation of patients ages and we have other generations of patients coming on, they're expecting that from a technology perspective. Like I know for myself, I'm Gen X and I leverage virtual, primary care visits. Like I only go in if I have to, like I don't, and for my kids, like I don't actually want to go in if I don't have to go in. So I think it's gonna happen.
And it does raise a great issue about training, right? Herzing is building telehealth into all of its nursing training as we go forward across the board. So we're building that kind of certification into our programming, just to ensure that, we know how to actually, one, not only just function in that, but how do you actually have a conversation on health? Really when you're talking about, asking very private, very sensitive conversations, not in person, right? How do you create that environment to support those efforts? So absolutely seeing more and more of that take place. I think there's work to be done on how do we incorporate utilizing the technology itself, but I don't think there's enough time that's gone on to stabilize that technology. It's changing so fast that it's a little hard to kind of grab some of that at the moment.
Yeah, and just to touch briefly on when you mentioned a little bit about career pathways and employees wanting to, one of the things that I think at Cornerstone, we are releasing products into the market that I think are going to revolutionize and democratize the way that we think about career pathing, where the employee has the ability to access and see their own pathway or multiple pathways without necessarily the intervention of a manager and using AI. When we talk about technologies, it's not just patient care technologies, it's also the employee experience. And for many of us, we might like, wait a minute, you mean they're not going to talk to somebody? But our own research that we conducted through Lighthouse showed that 80% of employees actually don't want to go to a manager to discuss. They first want to explore through technology. So I think we're going to see this. It's going to be an interesting shift over the next couple of years as AI takes off and we start to see these embedded not only in patient care, but also in the employee experience.
Yeah, I think when you start to talk about culture, it's about empowerment as well. And AI, there's an organization that I've worked with as well, called Anthill, and they do a ton of work on that front, around incorporating AI into the frontline employee experience, Cheryl. And they do some really cool, have some really great tools to allow those kinds of questions to be answered in this AI environment. And then you build reputation and trust with individuals at the front end by utilizing these tools. And then you can start to suggest to them, hey, think about your educational benefits, think about these other opportunities, think about, promotional opportunities, right? And then you can start to answer those questions for them based on this information that's out there. So some really cool organizational shifts that are going to start to happen as part of that. I think just jumping back really quickly, I know we're quickly running out of time, which is just crazy. I feel like we just got started and Cheryl and I could sit here and talk all day. But I think there's a couple of quick takeaways. One is, we've got to do a much better job of onboarding our nurses organizationally. That's got to be a focus. We cannot sustain the level of turnover that's happening today. We've got to really invest in creating pathways and opportunities for our employees to grow with us. Otherwise, they're not going to stick around. And then we've got to really work collaboratively between educational institutions and healthcare systems to find better ways to support legislation in our states, to look at ways to train more preceptors. I argue continuously, have we elevated the educational train so much that we only want a PhD nurse teaching somebody at the bachelor's level, right? I mean, there's some fundamental things that we really need to talk about with ourselves to say, doesn't somebody with 20 years of a BSN experience have the skill set to teach in the classroom day-to-day patient care, right? I mean, these are some of the questions we really have to ask ourselves, why we have these things in place today, if we're going to seriously quickly address the issues that are out there. So,
Yeah. And I would just add to that, again, from a tactical takeaway perspective, as you're thinking about this for your organization, the questions that I would be pushing on are, we need to make changes that are not just surface level changes. So for example, do we need 12, can we offer multiple shifts? We know that not everybody wants to work a 12-hour shift and that burns them out. We need more than just training to address burnout. We need leaders that are willing to step up and be there and support people, because we know that's what makes people stay. And we need nurses to know that they feel involved in the process and in the changes. And that's not nurses, that's all employees. We are all going to resist when somebody tells us how to do something, because that's our nature. So if we want to change this problem, we have to involve nurses as part of the solution in our hospitals.
Yeah, I was going to say, Cheryl, that was a big thing when we were prepping for this call, was this idea that nurses are on the front lines doing this work. Yep. And they are a key asset in understanding what can be done better. And so, but in order for us to create a feedback loop where nurses are actually telling their charge nurses or their direct supervisors or reporting, like, hey, this system that we have on this floor actually doesn't work all that well, or hey, I think that we can improve upon our patient care by doing X, Y, and Z. Whatever type of feedback it might be, whether it's constructive, positive, helpful, negative doesn't really matter, as long as there's the psychological safety that they feel like they can come and say, we can improve our organization, the care we give, how efficient we are, how happy we are, if you're willing to come to us and include us as part of the solution. And we've seen in surveys that there tends to be a lot of a disconnect between senior leadership and what they think the priorities are for the organization versus those frontline staff. And so even if we're employing or using engagement surveys or reaching out to those nurses, there needs to be a level of organizational honesty. So they have to feel like they believe that when they report to their senior managers and say, these are the problems we're seeing and these are the solutions we think might fix it, that the organization is going to say, okay, like, let's take accountability for fixing it, and that they'll actually follow through on that. So if you're going to include nurses, you have to actually include their feedback and be honest with them about your capabilities, what happens next, and how you're going to actually use their perspectives and their feedback to improve the
Yeah.
situation for all of their colleagues.
Yeah, and I know we're at time, just a real quick, just to highlight that we may have people on the call that say, well, we do employee engagement surveys. That's not what we're talking about. That's not getting their feedback. Getting their feedback is I can sit down with my manager or have a conversation right while we're walking to a patient room, and I can share something and I have the confidence that it's going to get fed up the chain. That doesn't always mean because I give feedback, right, it's going to get implemented, but what it means is I felt heard.
Yeah. And being heard is so critical in all of this.
Yeah.
All right. Well, thank you all. Really greatly appreciate the opportunity. Ren, last thoughts?
Yeah, last thoughts. So everyone, thanks so much for being here today. Again, we did not get to all of our questions, but I have noted them. And so we'll be following up with you just on some of these questions that were put in the chat. I see one from Melissa regarding more specifics around onboarding experiences. So we will look at other opportunities or resources we can send out to you as well. You can expect a follow-up email within 3 business days with the recording to this presentation, resources, and additional opportunities to reach out to us. But please don't hesitate to reach out if there are other ways that we can offer support to you in the meantime. Thank you all for being here. We know that this is a big topic and there was a lot of information covered, but would love to continue this conversation with you at any time. So please use us as a resource. Be safe for your long weekend. Enjoy your time. Take care of yourselves, and we will see you on our next coffee chat.
Thank you.
Thank you.
Thanks,
Bye-bye.
Jarvis and Cheryl. Have a beautiful weekend.
Thanks. Have a great weekend, everyone.
Bye.